All right, headaches. They're pretty annoying. They're common, and sometimes they're caused by nothing more than skipping your morning coffee. But then there's also the time when we could potentially be worried, or it could be something else, right? Well, today we have Dr. Kohli in to separate the just take a nap headache from the call a doctor now headache. Dr. Kohli, it's so good to see you.
Hi, Claudia. Do you get headaches?
Yes, I do. Not that often, but I do get headaches. And when I do, it's the ones that are just like on one side, or it's like a throbbing headache on just this side. And I get really nervous because then I'm like, what is that? Oh my gosh, what's going on? But we'll talk about that in just a sec. What are the causes of the more common headaches, though?
So one of the most common types of headaches that we get is a tension headache. And you can imagine it's because of our busy lifestyles.
Of course.
Poor posture, sitting at the computer too long, having eye strain, not getting enough sleep, not staying hydrated, having those muscles in our neck tense up. So that's a really common type of headache that a lot of people get. Migraines is another common headache, especially more common in women as well. That has a genetic component to it. But certainly things like lack of sleep, too much stress, too much traveling, those types of things can trigger migraines. And in this type of season, we also get those seasonal allergy types of headaches as well.
Oh my gosh. So it really depends on the time of year. Genetics also play a huge factor. But then I've heard that people, friends that are not fans of taking meds. What are other ways to get rid of a pestering headache or just a bad migraine?
Yeah, so I don't like to take medicines either unless I absolutely
have you have to?
Yep, so I always like to hydrate when I have a headache, and sometimes I'll even drink an electrolyte solution to help with the headache. Cold and heat therapy works incredibly well because a headache is really our nerves sort of misfiring. So if you can trick those nerves, so putting a cold compress on your head, for example, can really help calm those nerves down by constricting the blood vessels. And then if it's a tension headache due to muscle strain, putting a heating pad or something like that on your neck can certainly help as well. I also like aromatherapy in oils. So lavender oil, eucalyptus oil, or peppermint oil, just diluted. You don't want to put it directly on the skin, but diluted. Put a little bit on the temples or kind of behind your jawline here.
Yeah.
And that can really help sort of calm the headache as well by releasing chemicals that help with the pain.
Okay, those are all really good solutions, right, before you head directly to the meds. Now, when should, though, we worry, Dr. Kohli? When is it more than just a headache, or it could be signaling something a little more serious?
Yeah, so there are some certain life-threatening headaches that we should all know about. So first I would say is look at the onset and the severity. If it's a lightning onset, we call it thunderclap, and it's the worst headache of your life, that can be incredibly concerning for something like an aneurysm. That might have ruptured, like a brain bleed. If you've had head trauma, you bumped your head, and then you get a severe headache after that. If you have any kind of neurological symptoms associated with it, like blurry vision, nausea, vomiting, a severe headache, weakness or numbness, those can also be potentially concerning signs. Now, some migraines in people can come with neurological symptoms, but if you're someone who doesn't get migraines, so the pattern of the headache, it's a new headache for you, it's worse than before, that can certainly also set it off. And then if you have anything like a fever, especially now with all the infections that are out there, including measles and such, fever and a headache is always a concerning sign as well.
Okay, one of the things that always stood out to me, because I've got a teenage daughter, and I believe maybe a few months ago, she's like, Mom, I've got this headache that will not go away. But then she was seeing like light flashes while she was at school. And that scared me because I'm like, what's going on?
Yeah, so that can actually be a benign type of headache. These are headaches called cluster headaches. That can happen, again, based on the season and such. So certain types of things like migraines, you can have sensitivity to light and sound because the neurons in the brain can actually become more sensitive. So when I get my migraines, I have to be in a dark room with the lights off, not interacting with anyone because I get more sensitive. And similarly with the cluster headaches, you can see some of those flashing lights. And but certainly a unilateral headache can be a bit more concerning if there's any visual symptoms such as blurry vision or trouble focusing on something. You have eye swelling, because you can imagine you can have a sinus problem, you can have something called temporal arteritis, which can manifest as jaw pain. So if the headache is just on one side and you are having any neurological symptoms, always talk to your doctor about
it. It turned out, luckily, not to be anything bad, but the flashing lights was definitely concerning to me. When does it mean, what does it mean, I'm sorry, when it hurts, as I was mentioning earlier, just on one side. Like for me, sometimes I'll get just like shooting pains, but they're pretty bad. And that is scary too, because I'm not sure what's causing that.
So, I mean, that's sort of the type of headache tells you a little clues about what might be causing it. So like I said, it could be coming from your eye, from your sinuses. There's a serious condition that happens in older women called temporal arteritis, where you have inflammation of the artery here, where you get a headache and you get jaw pain, especially when you chew. So if you're having any kind of jaw pain, certainly that's something to talk to your doctor about as well. Certainly a muscle spasm on one part of your scalp. So one of the treatments we have for migraines is putting Botox into the scalp to help relax some of those muscle spasms that can trigger migraines. We don't understand migraines. Are they an allergy? Are they a muscle spasm? Are they a neurological problem?
Yeah.
Probably a combination of all of those. But a one-sided headache doesn't necessarily mean a bad thing unless it's associated with something visual.
With something else or, got it. Well, all great information this morning. Regardless, I hope you're not having a headache at home because they can be pretty bad.
They can be.
Yes.
And it's very common, one of the most common complaints in the primary care doctor's office. And knowing yourself, knowing your headaches, and knowing when to be concerned are really important.
Okay, Dr. Kohli, thank you so much. Always great info and always good to have you here as well. And if you have a question for Dr. Kohli, all you need to do is send it our way. Send an email to mycoco@9news.com and put Kohli in the subject line.